This is my audience. God, you guys.
Go.
Hi, my expository speech is on spinal cord injuries. Just to start out, this is a picture of an actual spinal cord injury. You can see the vertebrae coming in and crushing the spinal cord. To start out, there are 4 parts of the spinal cord. The cervical, which is located in the neck area, thoracic, which is in the rib cage area, the lumbar is in the lower back, and the sacral is in the buttocks region. There are 2 types of spinal cord injuries, quadriplegia and paraplegia. With quadriplegia, there's some degree of paralysis in all 4 limbs and the trunk, and paraplegia is in the lower extremities and possibly the trunk. The severity of spinal cord injuries depends on if it's a complete cut or incomplete cut through the spinal cord. If it is a complete cut, there's usually no sensation below the injury and no motor return, but if there is an incomplete cut, there's a possibility of that sensation returning. Some causes for spinal cord injuries include assault, falls, gunshot wounds, industrial accidents, motor vehicle accidents, which is the most common, sports injuries, that's typically with diving into shallow water or contact sports. Indirect injuries include arthritis and osteoporosis. With those, the bones usually they have holes in them and they'll shatter, and parts of the spine will get lodged into the spinal cord. Internal bleeding that causes pressure on the spinal cord, and then if the spinal cord is pulled, pressed sideways, twisted, or compressed in any way. Some risk factors include risky physical activities such as contact sports, not wearing protective gear during work or play, diving into shallow water. Typically, spinal cord injuries happen with men 15 to 35 years old, and that's usually because of their risky behaviors in driving. And then older people with their osteoporosis and arthritis also. Treatment includes corticosteroids, and that is immediately afterwards to reduce swelling and pressure. Other than that, they use surgery to remove fluid and bone fragments, and sometimes they'll usually fuse the bones together around the injury. They'll be put on bed rest for a period of time. It's usually 2 to 3 weeks. And then there's spinal traction, which elongates the spine and relieves pressure. And there's also spinal traction that immobilizes the spine. And most importantly, we want to educate the patient and the family on muscle spasms, bladder and bowel care, and how to assess the skin, because with spinal cord injuries, you don't feel below the point of the injury, so you don't really know where the body is and if it's rubbing on anything or if it's in an uncomfortable position. So we want to teach the family about how to assess that. And then, of course, therapies like physical therapy and occupational therapy. This is a picture of the 2 different types of spinal traction. This is the one that it will elongate the spine and relieve pressure. And this is a halo that usually happens with the cervical injuries. They place pins in the skull here to keep it in place. The prognosis, usually someone who recovers movement within 1 week usually has a good chance of improving, but after 6 months, the losses that they haven't gained back are usually permanent. They'll need a wheelchair or assistive devices to get around and do daily things. And then obviously home modification, we want to make sure the hallways and the doorways are big enough, and moving those things on high shelves down lower. Some statistics: 80% of spinal cord injuries occur with men, and that's because of those risky behaviors in sports. 42% of spinal cord injuries occur with vehicle accidents. So make sure you're wearing your seatbelt all the time. And just a little fun fact, they sometimes use Botox to prevent muscle spasms. That's my speech.